Well, I think that for sure in standard risk patients, the important point is to achieve MRD negativity prior to maintenance and to sustained for at least 2 years. So this is an important point. But for high risk patients, it's more important to evaluate very early on. So for example, the French group demonstrated the value of MRD negativity after induction. So in high risk patients, I would check serially for MRD negativity after induction, after transplant, prior to maintenance. In standard risk, I may wait a little bit. For sure, the evaluation prior to maintenance is important. Nowadays, we are giving maintenance to all the patients the same, but one day, for sure, we will be able to stop treatment in some patients or not. So that evaluation is very important. And well, my point of view now is that locally, I mean, in the local hospital, we should learn to apply systematically MRD. This is not the case, for example, in Italy, because until now, few decisions were made upon MRD. So, of course, you have also to spare some money. So now it's really important to start to monitor patients, because one day we will really take a decision on it. So that's important.